Hi, I'm Dr. Lowe. I'm a doctor who worked in New York City for over 23 years. I started this channel as a forum for us to hold discussions on any medical topics that you may find interesting or any questions that you may want answered. Today's topic is going to be a discussion on complementary and conventional medicine. And we shall try to conclude by the end of this two-part series, two video series, which is better for you. Now, conventional medicine is that evidence-based Western style medicine that we have grown accustomed to. It is sometimes referred to as allopathy. Allopathy is a term that was coined by Samuel Hahnemann in 1810, who was the founder of homeopathy. He coined the term as a portmanteau of two Greek words, allos meaning other and pathos meaning suffering. So you put the two words together, you get other suffering. And what they were referring to by using this word was to the fact that this system of treatment was based on treating the symptoms and organs of a patient and to use substances and techniques that countered whatever the symptom was. For instance, if a patient had constipation, they would give them cathartics or a laxative to help them to ease themselves. Now, this system was based on the teachings of Hippocrates, the Greek philosopher and physician who lived 400 years before the current era, BCE. And Hippocrates had proposed that there were four humors, namely the blood, the phlegm, the yellow bile, and the black bile. And he thought that there was a balance in these four humors when patients were healthy, and there was an imbalance when there was disease and patients were ill. So the practitioners of the time used techniques and used medications to balance these four humors. And this system of conventional medicine that existed at the time was called heroics. And the word allopathy was used derogatorily to refer to this conventional heroic system of medicine. The system heroics was called heroic because of the almost heroic measures that were employed to balance the four humors, such as harsh cathartics, emetics to make patients vomit, bloodletting, and the like. And these techniques horrified Hahnemann and his constituents. Complementary medicine is any medicine, any medical system, any system of diagnosis, prevention, and treatment that is not part of the traditional medical system of a particular culture or a particular country, nor of their general medical system. It is sometimes called alternative medicine if patients are not using it as a complement to the conventional type of medicine, but rather using it in place of, as an alternate form of treatment. Now, how big is this industry? The industry is growing. It is growing from year to year. As a matter of fact, in 2018, 107 or 88% of the 194 member states of the World Health Organization acknowledge the use of complementary or traditional medicine in their healthcare systems. 34 countries listed traditional or herbal medicines as part of their essential medication lists. In 1999, 45 countries had rules and regulations governing the practice of traditional and complementary medicine. By 2018, that number had risen to 109. In the United States alone, there are more visits to complementary and alternate practitioners than there are to conventional doctors. And the industry is a $21 billion industry in the United States alone. So who are these people that are seeking conventional and complementary and alternative care medicine. These are people who are not necessarily dissatisfied with the treatment they received in conventional care, but rather these are people with a certain philosophy and a view of life who are searching for a system that is suited to their particular philosophy and their particular view. Now, some people derive comfort from going to see a alternative medical practitioner. Some people derive emotional support, relief from stress. At other times, the practitioners of alternative care and complementary medicine are able to offer talk, touch, and time luxuries which the conventional doctors quite often cannot indulge in. At other times, there is a sense of control that is derived by the patient when they see a complementary or alternate medical practitioner, because they're able to participate in the decisions that are made, such as the type of treatment that they receive and the duration of treatment. And in some cases, people turn to complementary and alternative medicine as a last resort when, for instance, conventional medicine is unable to offer them anything more for their condition. For example, patients with disseminated cancer, when conventional medicine has no further treatments to offer, patients like that will turn to complementary and alternative medicine to hold on, to have a sense of hope. Now, one of the aspects of complementary and alternative medicine that makes it very attractive is the fact that it takes a holistic approach, or most of these branches of complementary and alternative medicine take a holistic approach to the patient. They treat the patient as an individual, and they will treat the physical, the mental, the spiritual, and the emotional aspects of their patients. And patients find this very attractive. So, what are some of the complementary and alternative medical techniques that are out there? The first one that comes to mind is one of the most popular, which is chiropractic care. But there are also other methodologies such as acupuncture, massage therapy, homeopathy, and magnet therapy, and there's a long list of different treatments. I hope that I've provided an insight into this complex and sometimes confusing topic of complementary and alternative care. Leave your comments below and I will respond to them.